So welcome you on board on behalf of Genix Pharma, madam. And as you know that regarding the prevalence of COVID in Pakistan, day by day number of patients are increasing, and number of deaths even are also. But the good thing is कि recovery ज़्यादा हो रही है patients की. तो इसकी हवाले से प्रेगनेंसी जो है एक बहुत कंसर्न और वल्नरेबल जो है वो चीज़ है. इसके हवाले से मैडम मैं आपसे गुजारिश करूंगा कि लेट अस नो अबाउट दी व्हाट आर द प्रिकॉशंस व्हिच वी हैव टू टेक इन प्रेगनेंसी एंड ड्यूरिंग लैक्टेशन.
Okay, thank you very much, Zubair. Assalamu alaikum. I'm Professor Uzma, as Zubair has already been told you, and I'm heading the unit of Gynae Unit 2 in Lady Wilingdon Hospital that is being affiliated with that of King Edward Medical University. So today, or in these days, the thing is that the COVID virus is being too much being under discussion. Actually, this is a virus that has been diagnosed first in the Wuhan, and then globally it's spread across the world. So now in these days, Europe and the US is being the most affected countries, but in our sides, still it is a dangerous if we don't take the proper precautions. So I was invited to for the discussion about its safety and about its prognosis or the diagnosis during the pregnancy. So first we are supposed to know how it is being transmitted. It is being transmitted by the two routes. One is the direct and one is the indirect. What is the direct route? It means the patient or the pregnant lady is going to be with the direct contact with the person who is being infected. So either she is going to be handshake or whatever that is within a 3 distance of the feet. She's being interacted with that person, and the secretion, the respiratory secretion of that person is being entered into the nose, into the face, into the mouth and ear of the pregnant lady from the sneezing, coughing, and talking of this patient. So this is a direct transmission of infection to the pregnant lady. And other is an indirect one, where the pregnant ladies come into contact with the touching of the surfaces and that objects being touched or contaminated by the infected person, and then she touches these infected hands to her face, to her mouth, and then she acquired the infection like this one. So these are the two mode of transmission. One is the direct and the indirect. So for the prevention, for the treatment, these two transmission routes should be blocked or should be prevented by taking some precautions. So the effect of the COVID-19 or the coronavirus on the pregnancy is that there's a little data that is suggesting that it can cause first trimester abortions, miscarriages, or preterm labor. There's no evidence for that. And there's still a very little evidence for that. It can also cause a teratogenicity to the baby. But there is a probability that it can be transmitted to the fetus. That is, there's a vertical transmission. There's a probability, and the two cases has been already diagnosed. Although IgG crosses, but the IgM does not cross the placenta. Now coming back to what are the effects of the coronavirus on a pregnant lady. So pregnant lady can be presented in two phases. One is the pregnancy and one is that of during the labor. If she presented in the pregnancy, she can have the symptomatology of 2 to 3 types. Either she is a mildly symptomatic and mild symptoms, then she can be examined and can be evaluated and can send back home for the 7 days for the quarantine, and then she can tell her obstetrician or to the other doctors which she has been contacted before that after 7 days what are the situation. She can even interact on the telephone. But for those patients who has a moderate to severe symptomatology, they should be hospitalized. And what is the criteria for the hospitalization? For this, the patient must have the fever more than 37.8. She must have a persistent cough with the breathing difficulty, or could be a sore throat, or could be a hoarse voice, and she could have acute respiratory distress syndrome, or she has a clinical and that of a radiological evidence of the pneumonia. And pneumonia, if that radiological evidence should be there, she should have the X-ray or radiology with the safety sheet of the leg. If the patient is having all these things, she should be hospitalized. And when she is hospitalized, some investigation should also be taken out. The most important is the CBC, where most of the time the lymphocyte as well as the WBCs are lower down. But most of the time in their lymphocyte could be also be on a normal side. So the LFTs also be taken. So when the patient is being hospitalized, she is being evaluated and assessed by a multidisciplinary team, which involves the consultant obstetrician, consultant pulmonologist, consultant physician, and consultant anesthesiologist. So when the patient is being admitted, she should be now assessed for the pregnancy and for the fetus. And there should be ultrasound, which should be ordered for the next 24 hours, and should be taken respiratory rate and that of respiratory rate, of fever, and oxygen saturation hourly for this patient, and also the fetal heart rate by taking the CTG for these patients. If the patient is fine and she is responding to the subjective asymptomatic treatment, she can be shifted to some proper, you can say, taking care of the facility. For these patients, there is location of the care is must. If the patient is having the that of respiratory distress syndrome and the pneumonia, she must be shifted to the intensive care unit, that is ICU. If she has a less symptomatology, she can be remain in a separate isolation rooms, or she can shift it to the ward. Even she can shift it back to the home. So it's extremely important according to symptomatology where the patient should be managed. When the patient is being managed accordingly, so the priority of the treatment, of the medical care is that this patient should be stabilized, patient condition should be stabilized with the available standard strategies or standard supportive therapies available. So these are for the patient who are pregnant. When they are being okay, fine from this side and can be sent back home, so they can again for the follow-up can call from the home, and after that 7 to 14 days, if they are feel good, okay, they can stay at home, they can have a quarantine for 7 to 14 days at home. The other group comes to us, and that is about the laboring patient. So here come we also again an important thing, how this laboring patient we can manage. So these patients should be seen in an isolation or a separate room should be available for this patient, including a specific team of a doctor that is going to deal with the patient all the time. So these patients then are being evaluated and assessed in an isolation room, and they are fully maternal, and the fetal assessment is being done along with the COVID symptomatology with the multidisciplinary team. If she must be again should be treated or should be followed 1 hourly for that of temperature, that of a respiratory rate, and that of oxygen saturation. Oxygen saturation should not be dropped down less than 24%. So these and after these should be for the 1 hourly, and after that the fetal heart rate can also be traced 3 hourly to 4 hourly according to the situation. If the patient is progressing for the labor, she must go into the labor and should be delivered vaginally until the problem rises for obstetrical side, then she can end up a cesarean section. Otherwise, there is no any guidelines or there's any evidence available that one mode of a delivery can be favored to another mode of delivery. If she is progressing nicely, she should be delivered vaginally. And if the condition of the mother needs urgent delivery, then elective cesarean section can be, or emergency cesarean section can be accounted to. Another thing, the patient should be, treatment of the patient should be individualized for the second stage of a labor, that it should be shortened by the instrumental delivery, you can say by the ventules, if the maternal condition is exhausting or the patient is having some breathing problems. And coming back to about the analgesia, there is no any contraindication for using that of a spinal, epidural, or general anesthesia for the patient, keeping in mind the patient has a mild to moderate symptomatology. If she is a severe in an ICU, then anesthesiologist is the person who can give the answer to this question more properly. So these patients, when they're being evaluated and being delivered, the person who is dealing, the team who is dealing these patients, they must have a proper PPE, that is personal protection equipment. And the RCG guidance shows that it should be gowning, could be gloves, could be face mask, and then the eye protection. And additional one thing is that, and that is a one apron, that is additional apron covering the gown to go for the delivery of the patients. So this is for those person who is being during the pregnancy and during the labor. So if the patient is not delivered nicely and she has been managed post natal or post operatively for the bleeding and the vitals, she can be kept in hospital maybe 2 to 3 days, and then she can be sent home with the specific instructions and precautions telling the patient to follow those ones. And your question about the lactation, yes. The day before yesterday, I was reading that the WHO, the UNICEF recommended the exclusive breastfeeding even for the patient who are COVID positive for their babies. So it is ideally preferable the baby should be isolated from the COVID positive mother in a separate room. And for these, there should be two things. One is that the patient should be baby should be separated from the mother in a separate isolated room, or if the mother is willing to keep the baby with herself, or the health facilities has not a good enough available space for the separate room, so the baby can be they can be kept in the same room, that we call it co-location or the rooming in. But here some precaution should be taken. The baby should be 6 or more than 6 feet apart from the mother, and there should be some physical barriers such as the curtains between the baby and that of her mother. So this is basically for the baby when it is being delivered, and how it's going to be kept after the for the mother who is COVID positive, because all these babies are being thought that they are a suspected or they're a case of the COVID positive. And about the lactation, so these babies should be must have the maternal breast milk. For the baby who is being separated temporarily for the mother, they must receive these milk maternal milk by the expression with the breast pump. So, but mother should be take a strict precaution while for the hand hygiene and that of the putting of the face mask while she is expressing the breast milk. So after the milk is being expressed, this should be given to the baby by a healthy caregiver. It should not be the mother. It should not be the person of the hospital. It's either the hospital personnel who is healthy or the caregiver, that is a relative. It should be healthy, and they should wear a proper PPE when they are going to give this milk to the baby. After the breast pump processing, or each you can say breast expression processing, every breast pump or every part of the breast pump that has been come into touch with the breast milk should be thoroughly washed and properly disinfected, and before starting the next feeding process. And at the same time, if the fetus if the baby that is with the mother in the same room and she wanted to feed the baby herself, again she has to take some precaution, and that is she must do the hand hygiene. She must put on a face mask so that her respiratory secretions cannot touch the baby, and then she can go for the breastfeeding and handling of the baby.
Okay, madam. Madam, one more question. Is there any possibility during a period of all 3 trimesters of vertical transmission? Is there any study regarding vertical transmission from mother to fetus in last trimester?
I already told you there is a probability. There is a probability, but it is not confirmed. No data specific suggesting is available currently that tells us that is a definite vertical transmission from all 3 trimesters. Basically, it is being transmitted most of the time at the time of delivery when the fluids of the maternal sides come into touch with that of the fetus. But there's 2 cases are reported where the fetus was positive to a COVID mother. But as you know, the IgM cannot cross the placenta from the mother to the fetus. So there must be an in utero infection separately that causes the COVID positive for these 2 fetuses. So, but the probability of there is always there for the vertical transmission from the mother to the fetus, but the rate is, or you can say, it is a very low.
Okay, madam. How you say that pregnant women are prone to COVID-19 or they are vulnerable to COVID-19? What are your expectations at this point of view?
Actually, they are susceptible as the same level as that of a common or general population. But as you see, and you know, the pregnancy is a state of slightly low immunity because it's increased blocking antibodies to contract with the 50% genetic makeup of that of a father. So pregnant women always on a lower side of the low immunity. So they must take the precautions to save themselves or to guard themselves from the transmission of infection to them. So the immunity, the pregnancy always changes the immunity level and that of other, how the patient behave or how the pregnant woman behave to that of a viral activity. It is differ from person to person. But as the immunity level is low in these patients, so the pregnant lady is at a more susceptible, you can say, as compared to the general population to have this infection.
Okay, madam. If a pregnant woman gets COVID-19, is there any chance, and she transfer it to her fetus, is there any chance of congenital anomalies of baby? Is there any study regarding
Yes,
congenital anomalies?
yes. No, there is no, there, at the moment, there is no current available data suggesting about the teratogenicity. I already mentioned we don't have a data that is suggesting that the teratogenicity or the congenital anomalies can be there due to the COVID, because still we have a 3 to 4 months of here. Maybe after, you can say, 9 months or 1 year, we can comment on these things. But at the moment, it is not possible to comment about this teratogenicity. But on the whole, they say there is no effect of this virus on the teratogenicity or the congenital anomalies still at the moment.
Is there any patient reported till yet in Lady Wilingdon of
Yes,
COVID-19?
there is one patient. She was delivered, I think so. She was a suspected case of coronavirus. She came with us about the 7 centimeter, and we delivered. Actually, we have a very nice isolation and the separate delivery and delivery room, and that of or also the OG separately. So she was delivered in that setup, and after that, she was then transferred to the new hospital for the proper management postnatally, and she was delivered vaginally. It was,
Okay,
I think, 4 to 5 days
okay, okay.
in my
So
emergency.
she has completed as 36 weeks or 40 weeks, or she was in her last trimester or the second trimester
She was
probably.
in labor. She was in labor. She was in
She
labor.
was in labor. Okay, that's
She
great.
was in labor. She was about to deliver.
And
So she
we have
presented at the very late in the labor to us.
we have heard some myth-like types of COVID-19 is weak when it comes to Pakistan. It has actually changed its morphological structure in it. That's why we Pakistanis and in Pakistan, the COVID-19 which has came has not got such power which it has got in China. Is there any morphological structural change in China virus?
Yes, yes. I was reading research from the Dow Medical University. Yeah, the virulence that is some by in China was very virulent, and there was a very high level of mortality and morbidity, and as compared to the in our Pakistan, because the number of the cases are still in a very low, and the number of mortality is also very low. So other day I was looking for or I was reading. Research from the Dow Medical University, and these were telling that we have a angiotensin gene that is being resistant. For the virulence of this virus. There's 2 types of the genes, and there's a gene 1, I think, and gene 2. They have represented in our Southeast or in the Pakistani people. So this gene has a somewhat mutation, or it is a resistant for this virus to have a more virulence and the more morbidity in our setup or in our type of a population as compared to the people that is in a Wuhan or in a China. So
Okay.
they done research, and they actually give the conclusion evidence-based that we people are resistant to this virus due to our genetic makeup or the mutation of the gene that causes the extremely virulence and morbidity and mortality.
Well, actually, thanks to Almighty Allah that He has protected us from
We
all
need
such
the
type
dua
of
at the
virus.
moment.
Yes. Madam, in last, what do you advise to your patients that are sitting home and they are in first trimester or second trimester? What are the precautions which you
Yes,
advise?
so you the precautions. The precaution is the same as that is the general precaution for the other people. But I already told you the pregnant lady is always at the lower level of the low. You can see a slightly low level of the immunity. So this woman should stay at home. They should take care of interacting with that of relatives and family members, and they should not go outside if there is no need of it, and they must go for the hand hygiene and covering their face with the mask if the symptomology of upper respiratory tract is anywhere in the family members. As the woman is a pregnant lady, so she must also have a very well ventilated rooms, because the current of the air can take the stagnant air outside also. And to the other way, I also reading that ultraviolet rays, they can make this virus inactive, and 1 degree rise in the temperature can reduces the transmission up to the 13%. So these women also should go for the antioxidant diet that increases that boost of the immunity. And these are very simple diet. That can be a fruits, that can be a vegetables. In vegetable, carrots and broccoli is the #1 antioxidant diet. And go for the fruits, that's all the citrus or the lemon. मैं तो अपने patient को कहती हूँ go for a lemonade. एक नीम गर्म पानी में एक नींबू डाल के पी लें आप. That is a very good antioxidant vitamin C. For the citrus fruit, all the berries, especially the strawberries. You see, this is the मौसम है आजकल strawberries का, and they should go for this diet. This diet increase in zinc. There's those diet which have more zinc in the food, and that is most of the vegetables and the fruits. So women go for these fruits and the vegetables to enhance, to improve their immunity, and at the same time they also slightly increase their meat, or you can say meat checkup, because antibodies are being formed from the proteins. The protein intake should be more.
So there is a wonderful advice from you that sunlight is UV lights. You can
Sunlight extreme, ultraviolet rays. All the viruses are being given by the ultraviolet rays.
Is there any role of vitamin C?
It doesn't matter that you should sit in the sun all the time.
But there is a time. Yes, there is a time, 9 to 9:30 or before 10. Yeah, morning evening time of sunlight. Yes. Is there any role of vitamin C in boosting up the immunity of pregnant women? And she's advised to take vitamin C?
Because it is an antioxidant. It is an antioxidant. It boosts up, it improves, it makes the immunity too much a good level, at a high level. All the antioxidants, they improves the immunity of all the, they do the 4 things. They are anti-cancers, they are anti-aging, and because they are good for the fertility. And most important is, 4th is, okay, #1 is it, that they increases the immunity of any respective person who is going to take these antioxidants. It's vitamin C. Vitamin C is a good antioxidant that boosts up the immunity of especially a pregnant lady. So मैं कहती हूँ कि उनको 1 ग्लास डेली 1 लेमन डाल के ले लेना चाहिए, क्योंकि अब देखिए सिट्रस का तो मौसम चला गया, कीनू तो चला गया है, लेकिन लेमन इज अवेलेबल ऑल द ईयर. So 1 glass पानी में 1 lemon डाल के every person can take it. आजकल strawberries भी आ गई, गाजरें still is there. They can go for that, because गाजरें तो हैं, these are also #1 for the antioxidant diet when you go for the vegetables.
So pregnant women need to take a bolus dose of calcium, vitamin D, and vitamin C, boosting up the immunity and to keep.
Yes, vitamin D, there's a specific limit to the vitamin D, because if vitamin D is given more than that, it can be also teratogenic. Okay. Vitamin D cannot be given from 400 to 800 international units during the pregnancy. It cannot be given more than that. So the things, precaution should be taken into account to that. That vitamin D should not be more than 800 international units in a pregnant lady.
Thank you
but
so
vitamin
much.
C she can take.
Thank you so much, madam, for your lovely time, and really it's been an honor for us that you are on board with us, and especially ये एक patients के लिए बहुत मुफीद आपका lecture होगा कि जिसमें आपने vitamin C, vitamin D, calcium, sunlight. ठीक है मैडम, thank you so much. अपना बहुत ख्याल रखिएगा. You are very अनमोल and we are very precious diamond to us. Seriously, आप अपना बहुत ख्याल रखिएगा.
Thank you very much. Thank you very much.
Allah Hafiz. Allah Hafiz.